Hello, this is the prototype version of COVID Buddy, which is an application meant to help foreign workers affected with the coronavirus. So this app allows us to interact with them and get a very clear sense of the symptoms, especially when many of the foreign workers may have a low literacy rate and can't actually read and even write in their own language. And it also tells them what medications to take and what their results are. So first off, we actually give them several languages because foreign workers often hail from countries like Bangladesh, from India, Thailand, and even like Myanmar. So this actually auto detects the language already used on their phone. Um, and we are able to get basic details that are actually very important for us as medical professionals. Things like actually what is their address for contact tracing, and even like what's their actual phone number so that we can actually contact them if any results have come out. Next, we actually ask them about symptoms, and these are pictures and audio that have been curated. So we actually ask them how are you feeling, or are you actually short of breath? And of course, if they are short of breath, this is in English, where they can actually seek medical help because that's actually one of the signs of deterioration. But further up more, we actually ask them various signs and symptoms that are common in COVID, like is this a sore throat? And do you have any muscle pains? Do you have any stomach pains? So these are very important because many of them are very visual, and if they have any questions at all, they can actually ask a friend who can just read out the question. So the questions here are actually like, do you have stomach pain? Then if it's yes, they can press the green button, and that's like yes and no. At the end of it, we actually have a QR code, and that actually allows a doctor to scan the patient's phone from more than 2 meters away. So essentially, we're able to get a history without incurring too much of an infection risk. It's like social distancing for doctors. And more importantly, when we give them medications, it actually tells them like for a fever, please take 2 tablets of paracetamol. And we even include an audio explanation. So this will offload a lot of our work from the pharmacist and the nursing side to explain medications. Lastly, we actually tell them some of the results, like your chest X-ray is actually normal. And this is very important because as doctors, we often try to tell them a lot of information, but they may actually forget it later, or we may not actually have the time to properly tell them their chest X-ray results, whether they are coronavirus positive even, and where they are going. So this is very important to reduce the uncertainties faced by patients and actually their anxiety. Because if they are able to hear it in audio, we can even send the audio to their families back home in Bangladesh or India. So 350,000 workers have 350,000 families who are quite anxious and they want to hear what's going on because many of them are also illiterate. So we designed it to be very audio and visual. Thank you.